Are you thinking about becoming a medical entrepreneur? Then congratulations, you're one step closer to freedom through prosperity. And to help you further along, I'm going to share with you the top 4 paths to success for an aspiring medical entrepreneur. So let's dive in. One of my favorite paths in medical entrepreneurship is the field of aesthetics. I personally love aesthetics very much because it is an amazing field that has great, deep patient connections. When a patient comes to you and they tell you about a vulnerability or a flaw that they see in their appearance, and they're asking for your help to fix it, there's a deep connection and trust made when that happens, and it makes for an excellent, patient relationship. And when you're able to take someone and give them the confidence they've always wanted to have, there's something magical about it. Just to give you one example, is that one time we treated a lady who came in, and she was always known as the ugly sister in her family. We were able to do some modifications for her and enhance her appearance. And she came back with tears in her eyes and said, for the first time, she feels like the pretty sister. And it was just something that was so emotionally moving. And when you're able to deliver those kind of results to patients, there's nothing quite like it. I love aesthetic medicine for that. Plus, it's a very fun and engaging field. Your clients are, for the most part, very, very healthy. They're kind of more like wellness patients, in a sense that, like, they're doing things to get better. You're not necessarily treating for illness. It's an excellent field, and it's a field that you grow. And as your skills grow, the more you're able to help more people, and the more people you help, just it becomes this virtuous cycle. So I love aesthetic medicine. I think it's an excellent path to medical entrepreneurship. So what do you need to get started in the field of aesthetics? You need to have excellent education and mentorship. And here's what I mean. There's a lot of places that offer classes in aesthetic medicine where you go for a weekend and you may learn how to do Botox and filler. The reality is that you'll never get proficient in such a short time frame. So what you're looking for is, you're looking for an educational system that will allow you to learn the didactic part, like all the muscles of the face, all the different products you're going to use, all the different treatments that are out there, and then come to a location for hands-on training where you can practice repetitively again and again on real life models with an instructor next to you. Even when you do that, you also need to have some mentorship, because over time, aesthetics really is an art form. It is a practice of medicine. It is truly an art. And so by having a good community that surrounds you and having a mentor, basically that will make you into a excellent aesthetic practitioner. So what are the benefits to practicing aesthetic medicine? One is time freedom. This is probably the most important thing for people that are practicing aesthetic medicine. The reason why is because many of the people are escaping the mainstream medical system, where their time is controlled by someone else. Maybe it's controlled by the flow of patients. Maybe it's controlled by the demand of hospital administrators. In aesthetic medicine, you can set your own schedule. You can decide to work after you drop your kids off, and then stop working before you pick your kids up. You can set your hours to work whenever is convenient for you, and people will come to see you during that time. It also has an amazing amount of freedom in terms of the ability to practice the way you want to practice. You have a lot of control and freedom in the way that you interact with patients, in the way that you might approach different problems that you run into aesthetics, the way you treat different, fine lines, etc. You have a lot of freedom in that regard. The income is probably one of the higher incomes that is out there. It's not uncommon for aesthetic practitioners to do very well. And what I mean by that is, the average medical spa makes 1.2 million a year. And I've seen a registered nurse, like just RN injectors who have been around for a long time, make $250,000 to $300,000 a year just practicing aesthetic medicine. Just to give you one example of a great story that I've personally seen here is, I have seen many what are called CRNAs, or certified registered nurse anesthetists. These are the nurses that are basically in the operating room that do anesthesia. And for a lot of people that are a CRNA, what happens is that they're basically in high demand, and so they can't control their schedule. Many times they'll have to get to the hospital, say around 6 a.m. for a case, and then they won't necessarily know if they get out of the operating room at a certain time, because it depends on the flow of the patients. So, for example, if there's an emergency surgery or there's an add-on, their ability to leave the hospital can get pushed off, and they may not be able to pick up their children on time, make it to family get-togethers, etc. So while it is a really good, high-paying field for a lot of nurses that become CRNAs, it comes with a burden of the lack of control of time and freedom. And so I've personally seen several CRNAs who've actually started their aesthetic practice on the side while they were working as a CRNA and then transitioned completely over to that, where now they practice anesthesia 1 day a month. But most of their time is spent in their aesthetic practice, which makes them more money per unit time. So making more dollars per hour, and they're in an environment they love, and they can control their schedule. So it's kind of the best of all worlds. On the second path, one of my favorite things is becoming a medical expert witness. And the reason why I love it so much is that it's a great part time or side hustle. Becoming a medical expert witness means that you are giving your expert medical opinion from the years that you've used practicing in medicine, usually in the form of a report or possibly in the form of a disposition to an attorney, to a court, to an insurance company, to a variety of number of different companies that will be happy to pay you excellent rates for your opinion. It's quite common for businesses that engage in the healthcare field to need an expert to review medical records, to review how things were handled, to determine if they were handled correctly and what can be improved upon, etc. So, what do you need to get started? The great news here is you don't need much. You simply need a laptop, an internet connection, and the ability to read. And you already got one of those. So, it's a very low cost way to get started, and it pays very well. It's not uncommon for medical experts to be making somewhere between $125 to $325 an hour just to review medical records. You also will need to have some training in how to become a medical expert. There's certain ways that you have to phrase things, there's certain ways that when you interpret data, the way that you write your report in a legal manner. Also, it's really important to get training so that when you talk to attorneys, that they know that you have some experience, they understand that you have been trained in this, and that you're not somebody they're going to have to teach how to do this. What the main benefits are is that it can be done anywhere. You can do it when you're on vacation, you can do it in your off hours, and all you need to have is just basically a computer. Majority of the time, what happens is that an attorney will contact you with a case that they need your expert opinion on. Many times, these are attorneys that basically are going to trial. They might be defending someone in a medical malpractice lawsuit. They may be suing an insurance company, saying the insurance company didn't pay correctly, and they need to have another medical expert review the case to see if this is standard of care. They may also be with a governing board, for example, a nursing board or a medical board that needs to have a practitioner who is out there, doing the day-to-day things to say, yes, this is standard, or no, this is not standard. And so you're going to be giving your opinion on this, and it's going to be an excellent way for you to contribute in a different way than mainstream medicine, where you get paid handsomely for your time. And what's really great about it is that you get to set many times your own hours. You'll have a deadline of when the thing is due, but how you get it done is up to you. There's nobody, no boss over your shoulder watching you. It's up to you. And many of the times, it is really most of your energy and effort essentially is in reading medical records and understanding what's happening for treatment, and then giving your opinion on that treatment and giving your opinion as to whether the standard of care was followed. So it's a great field, a great way to take your first step to kind of starting your own business. And what's great about it is that when you become a medical expert, you build a business which automatically gives you tax advantages as well. One of the best benefits that I receive when I do medical expert cases is it gives you a pulse on kind of what's happening in the industry. Because you're reviewing medical cases that are usually going before a governing body or before a court, you can kind of see what trends are going on. You can also see what other people are doing in their documentation, be that right or wrong. And then in the end, it also improves your practice because you're seeing other people who may have made a mistake, or other people who are being questioned about their documentation, and you're reviewing it. You basically learn the best standards of practice in your medical documentation and in your practice just by reviewing these cases. Path number 3 is doing a ketamine clinic. These are getting more and more popular. As you may be aware, there's a large population of people that have chronic pain, PTSD, depression, etc., where standard treatments are just not helping them enough. Ketamine is a very interesting medication. And by having ketamine clinic, you can infuse ketamine, which has been proven to help people deal with these issues, and many times gives amazing results. Whereas, in the past, some of these patients may have tried every SSRI, every every type of antidepressant, different medications with minimal results. Sometimes when you have these patients undergo a series of ketamine infusions, the results are absolutely miraculous. It's a very good business. It also has a very deep connection, and you're helping a lot of people that are in pain, a lot of people that are having issues with their psychological processes. And when you're able to sit down and show them compassion and care, and then deliver an infusion that improves their life and an infusion that gives them a different way to look at life, the results are just phenomenal. And for many people, that the practice of that is, just really well worth it. Most ketamine clinics operate on kind of on a cash basis where they basically charge cash. They don't have to file insurance. Some insurances cover different forms of ketamine. However, majority of clinics stay cash or insurance free, so they can offer the most wide range of solutions to their patients. What do you need to get started? You definitely need training on how to get started. Ketamine infusions require the use of anesthetic agents. So many times we'll be using a CRNA to do these infusions. There are forms of ketamine that can be administered by an RN intranasally, for example. So there's going to be a learning curve on that. Obviously, there's going to be certain patient selection criteria that you'll need to learn, and just how to run the business in general, how to find these people, where you can get referrals, et cetera. All that comes in your training. And so you'll definitely want to have good, thorough training that discusses not only the clinical practice of ketamine infusions, but also the business practices. And what are the main benefits? Once again, the benefits of this is that you are running your own ketamine clinic. You can set your own hours. You get to help people that many times you're kind of their last hope. You're the one who steps up and helps them when the modern healthcare system couldn't. The other benefit that you get is you also develop deep connections with patients as well. These patients are in psychological distress many times. They have PTSD. They may have depression that's refractory, and you're able to help them. And when you do, it instantaneously makes a deep connection and bonds. And they share things with you that they maybe don't even share with their own family. The other main benefit that you have is that you also have the excitement of basically having ability to infuse medications into someone physically there and see the result instantaneously. So often in medicine, we prescribe a treatment, we give a treatment, and the results take, 12 weeks, 6 weeks, something like this. With ketamine infusions, the results are instantaneous. You can see that work right away. And people often will feel better after their first treatment. So it's a really rewarding, and it has a little bit of that instant gratification that people like as well. Probably one of my other favorite pathways for medical entrepreneurs is the pathway of regenerative medicine. It is a brand new field that is growing like crazy. It is a little bit um, like the Wild West. There's still all these new therapies coming in, and it's a very interesting field. Basically, as you may know, modern medicine doesn't do that much to help people in pain. In fact, if you look at majority of the pain management procedures, they're often procedures that either help temporarily, or there might be procedures that, for example, that do a nerve ablation where you destroy a nerve, knowing that nerve will grow back in a year or so. Most of the procedures that we're doing are things that are kind of more like band-aids. Regenerative medicine, on the other hand, is more like a permanent fix. By using advanced regenerative factors like growth factors and other healing modalities that are cutting edge, you're able to offer patients a true path to actually heal areas of their body that many times other doctors haven't given them that option. Regenerative medicine is also very exciting because the patient population for regenerative medicine in general are people that want to get better and keep performing at high levels. These are often people that are healthy, they're doing well, they're successful on many areas of their life, but they may have an issue for example, such as like knee pain. They may have knee pain, but they don't want to have a knee replacement surgery. They've read about it, they've read about the risk, they may know somebody who had one and didn't work out well. They want to do something different. And so you can use these regenerative medicine techniques to help heal areas that in the past weren't even options before. Also, with regenerative medicine, you get to have great patient interactions. When you're able to take someone, like, for example, a guy that I treated once basically came and he had severe knee pain. He was a guy in his 50s, successful guy, had his own business, just really loved what he did. He was in very good shape otherwise, but he got to a point where he just couldn't work out anymore because his knee pain was driving him crazy. He loved to bicycle, but he couldn't cycle anymore because his knee pain hurt him. After his treatment, he could cycle again and he could even go ice skating afterwards. And he would send videos and text messages back to the office just saying how grateful he was for the treatment. When you're able to help someone to that level, there's just such a joy and such a great reward that you get. And so it's just such an excellent field. What do you need to use to get started? Regenerative medicine is somewhat of a complex field. It's always changing and it's always growing. So you have to have excellent training that's up to date on the latest products and techniques. Additionally, regenerative medicine is a great add on if you already have an existing clinic. However, if you don't, many times you can build a clinic in someone else's practice. The main benefits are that it's regenerative medicine primarily is all cash pay. Many of the insurances don't cover these treatments, so it's all cash. You get paid immediately when you do the procedure, and you don't have to get a pre-authorization from an insurance. You don't have to have the front desk, figure out this person's insurance and check to see if they have this deductible or that deductible or, whatever, like all these complex things. You basically can select what is best for the patient and then actually offer it to them, and the patient pays for it, and you can treat them and the patient can get better. It's like the way medicine used to be. It's really, really nice. One of the main benefits besides that is once you start basically practicing regenerative medicine, oftentimes your practice will grow like wildfire. And the reason why is because once you deliver a result to somebody that is life changing, like the example I gave before about the man with the knee pain who could now be able to do things like cycle again and ice skate, he tells all of his friends, and then all of his friends come to you and say, "Hey, I heard that you did this. Can you do the same thing for me?" Or I heard you fix this guy's knee. I have a problem with my shoulder. Can you do the same? So it's a very good business for word of mouth, and your business will grow very quickly because of that. Additionally, it offers the ability for you to learn new techniques and new technology. They say the average person when they get out of training is about 10 years behind the current standards because they're learning things that are old. Well, with regenerative medicine, that field is being updated every day. Every month, there's a new publication, a new letter. So you're always getting new technology and new access to new products that in other fields things are more stagnant. So I really enjoy regenerative medicine because there's always new things to learn. There's always another product that has some kind of benefit. And it's always something new, something growing. It's really exciting field. So one of my favorite stories of practicing regenerative medicine is I had a patient who's a very nice lady. She was very successful and basically went one day up to the top of her attic because she was looking for some Christmas lights. Unfortunately, she didn't realize that I guess, in the attic, they have these rafters. And normally there's like pieces of wood over the rafters and you can walk on those pieces of wood. Unfortunately, one of the pieces of wood gave way and she fell through the ceiling of her house and ended up landing on her tailbone 2 stories below. This caused her to have a damage to her coccyx, basically the tailbone area. And she went to several doctors in mainstream medicine, and everything under the sun was recommended to her for treatment, all the way to even a hysterectomy for the tailbone pain. And then she came to see me. And she'd come to me because of a word of mouth referral. And her and her husband basically came to the clinic. And the first thing I did was look at the tailbone under fluoroscopy, and we very clearly saw that it was displaced. By using regenerative medicine, we were actually able to heal that and get it back into place. And before that patient, she couldn't even sit down. Everywhere she went, she carried a donut with her, basically to help protect that tailbone because it caused so much pain and discomfort for her to even sit. She couldn't enjoy the things like going. She was a very social person. So she also had, get togethers with other friends and family. She stopped going to those because she felt embarrassed that she had to carry this little pillow cushion around and she couldn't sit down and enjoy meals with other family because the pain was that intense. Additionally, she loved to go to the theater with her husband, and she couldn't do that because the way the seats were tilted were such a way that it actually caused more pain, and she couldn't sit down long enough to even enjoy the theater or enjoy a movie. And it was just a total change in her lifestyle. Once you're able to heal someone like that, that gives you something that you've never had before. It's just a joy and a pleasure. For her, we're able to fix that coccyx. We're able to take away that pain. She can now sit pain free without using a pillow or a donut or any of that. And she's able to enjoy her life. When you're able to restore someone's life like that, the value you give is enormous. And you feel back from the patient all of their things, all of their gratefulness, everything. And there's just nothing like it. It is truly the art of medicine. And that's why I love regenerative medicine, because you have the ability to heal others. And it's just an amazing, amazing field. So if any of these paths sound good for you, then please learn more at freedomthroughprosperity.com.